the first question I wanted to ask is what is the best way for a person to just return to any doctor's offices? Should we still wear gloves? Should we wear masks? What type of precautions should we be taking as we look to get back to doctor's offices?
Okay, yeah, masks and gloves. Well, face masks are a great idea. Face mask is a commitment to protect the community and the people with whom you interact. Remember, I wear a face mask for you, and you wear a face mask for me. So for at least the near future, Health First is requiring face masks in all of its facilities. And, if someone doesn't have one, then we'll gladly provide a mask for them. Conversely, gloves are not a good idea. You can't contract COVID through your hands. But if you touch a contaminated surface and then touch your face, you can acquire the disease. So the best thing you can do is frequent hand washing or using hand sanitizer. And that's not easy to do if you're wearing gloves.
Very true. And, we're seeing a lot of, unfortunately, gloves, people are leaving them in parking lots or throwing them out their car windows. So it just, for so many reasons, it sounds like gloves just.
Not a good idea.
Yeah. So as far as going to the different types of doctors, should people prepare themselves in any different ways, or see if the doctors that they're seeing are doing anything different? Because I feel like when I've gone to my dentist in the past, they've always, worn a face mask, or if you go to the eye doctor, they're wearing gloves. Should we look at different doctor visits differently, or is everything kind of equal?
Well, as a patient, you don't really have to do anything different. Again, good hand hygiene, wearing a face mask. But you will notice, depending on the specialist, that the providers may be doing things different. And the closer they get to your respiratory tract, to your face, the more you'll find that they'll be wearing different forms of protective equipment.
Should most people continue the virtual visits? When should you say to yourself, I need something beyond the virtual visit? Or, where do you fall on telemedicine?
Well, virtual visits have been a great alternative. In fact, about 50% of our visits right now are actually happening virtually, where before COVID, almost none were virtual visits. Our customers love them. They're much more convenient, so I don't think they're going to go away. But likewise, in-person visits aren't going to go away either. I mean, sometimes you need an exam or some kind of diagnostic studies done, or maybe it's a more complicated visit where it is going to require an in-person interaction.
What are some of the differences that we'll see at doctors' offices? Will they be, spreading chairs out more in waiting rooms? Will they try and target times a little bit sharper on appointments? Like, what are some of the differences you think we'll start seeing?
So, for example, in our medical group, when individuals call for an appointment, they're sort of pre-screened, so we get some idea of, are they coming with a respiratory problem, which makes it a higher risk encounter? Are they coming maybe because they sprained their ankle? We triage them. Sometimes a virtual visit would be appropriate, and if they're willing to do that, again, they find that more convenient. But if they do come into our offices, we've enacted social distancing by spreading out chairs or having chairs not occupied, so if someone were to be waiting for their appointment, again, they wouldn't be crowded. The folks work in our facilities as well as the patients, again, we're doing universal masking, so everyone is protecting each other. So there's a variety of things that will probably be done, certainly at least into the near future.
Yeah, I was speaking with a gym owner last week who said that once they're allowed to open, they're going to be using those kind of like shotgun thermometers on people. Can you see a scenario where maybe they're using those in ERs or just for regular office visits when the first thing when people come in, or, almost like screening for security? Now you have to check someone's temperature.
I very much can. In fact, there's a national shortage of those. They're very difficult to get, and we're acquiring them, but we had to jump through quite a few hoops to get them. But we're also looking at infrared cameras where when folks enter the facility, their temperature would automatically be taken, and if it was elevated, it would immediately flag them. And that's much less obtrusive and doesn't require someone standing there, to your point, sort of shooting a temperature as they come in.
Absolutely, yeah. And how about cleaning of facilities? Do you think there will be more cognizant? Someone gets up from a chair, it needs to be cleaned. Things like that as far as cleaning measures.
Yeah, definitely. So we follow the CDC guidelines, but what we've seen from polls as well around the country in terms of concerns that patients have, and particularly coming back into medical facilities, or things just like touching doorknobs. And so we're putting special emphasis on sanitizing those areas where our visitors will be returning on Friday, where they'll have those kinds of interactions so that, again, we keep them safe and they feel more comfortable.
What about, they're talking about the elective surgeries and things like that started up again this week. If you were just to kind of put people at ease about coming in for these things, what would you tell potential patients?
So again, the steps that we're taking around temperature checks, universal masking, the type of sanitization that we do certainly creates a safe environment. Likewise, we've literally tested hundreds of our associates, our caregivers, and all of them have been negative for COVID. So we do feel like it's a safe place to come.
All right. Is there anything else that you'd like to add about safety for this, or for, even for those other segments where people don't feel comfortable? Should there be that big a gap between things, do you think, or should, people kind of, if they take the same precautions for everything, that's as safe as you can get?
Well, obviously, come back when you're comfortable, but don't put off needed care. We've seen here at Health First, and we've also read about it in the media, of people with heart attacks, even appendicitis, that did not seek care because they were afraid of the unknown, so to speak. But then the reality was they suffered the complications of what was occurring. So we're open, and it's safe to come here.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.